Hello, friends. I'm Holly Elissa Bruno, and I have the delight of having two fellow travelers with me. Crystal. Hey, Crystal.
Hi.
Crystal Sanford Brown, just finishing her lunch. And all the way from across the pond, we have Nick Emma Hart. I'm so glad you guys are. Hello, sweetheart. And we're late, not because either of those two ladies were late. We're late because of me. And I want to tell you what's going on. This topic that we chose is a tough one for me. It's tough. And here's the topic, and I'll tell you why. And I'll invite you to consider how you feel when you consider this topic. The topic is what happens? How can I be true to myself when I'm in face to face with the original fear that I had when I was being traumatized as a child? When I am taken back to that moment. And it's very hard for me sometimes because the abuse started pre-birth with me.
Mm,
My mother was psychotic. And so you all know about cortisol is this enzyme that puts us on edge. And so I'm sure that with my mother's trauma herself, with her anxiety, with her mental challenges, she had cortisol streaming through the placenta. And so I got that. And then as soon as I was born, there was a horrible incident where my father was outraged, absolutely murderously enraged that I was not the son that he was supposed to have. So from my
mm.
birth, there was trauma. There was my father yelling at me as a baby. I didn't know, but he would yell, "Get her out of my sight." And then
Wow.
also, very shortly, the sexual abuse. I mean, children are never, I'm so sad to say, never too young. Hate it to be sexually abused. Yeah. And if you're listening and you know what I'm talking about, I'm with you. So here's the tough thing. When I choose to be in a situation or I'm put in a situation where I'm reminded of what that felt like to be totally out of control, to be totally in the power of somebody else who can hurt me, that can scare the bejesus out of me. And why am I late? Guess what? I'm afraid to talk about this topic. I'm afraid. Why? Because I have chosen, because that's me. I'm a trauma survivor. I'm not an infant anymore being abused, but I can feel like that. Even though I feel like that, that's me. I am choosing to have two invasive procedures. Do I want to have them? No. Do I want to be healthy? Yes. And I'm not going
Yes.
to get into details about this, but one of the invasive procedures is called, guys, if you're over 50, you know what it's about, a colonoscopy. Now, I'm used to the,
Ooh.
oh, honey, anybody love those?
Oh no, I don't love them. I had one over the summer. So
Yeah, yeah, honey.
thank you for addressing the trauma we may feel in keeping ourselves healthy. And I'm going to, I don't want to stop what
You go,
you're
girl.
saying.
No, you go. Go, please.
No, because I want you to address how difficult, and I too will share, but it can be so traumatic. Mm.
And I see Nick, you're nodding. Do you know what we're talking about, Nick?
To be
And
all completely
how would you describe, Nick, the feeling you have when you have to have something done that's invasive and scary, but you don't have a choice if you want to be healthy?
it's very, very scary. And I think um as a single parent who has been the only sole person that was always there for my kids,
Hmm.
it was I had a massive tumor on my womb, which was the size of a rugby ball.
Oh
And
Lord.
Oh,
so I had to have a hysterectomy. But before that, my organs were failing, everything was failing. But because I do herbal stuff as well, that was keeping me going. But to be honest, it was more of a trauma of shit, you know, I'm not ready to leave my girls.
Right.
You know what I
Oh,
mean?
I hear
I
you,
think,
Nick.
yeah,
Oh my God. So what you're saying to us is the double whammy fear, which is you are responsible for your babies, your daughters. You're responsible
Mm-hmm.
for them. And yet at the same time, you got to be healthy to be a mom. And so there's really no choice. But there is a choice. And the choice that here it is, Crystal, I'm going to answer your question. I'm going to ask everybody who's listening. How many of
Mm-hmm.
you have befriended avoidance? How many of you know denial really well? I mean, when we look at Elizabeth Kubler-Ross's pathway about grieving, the first thing she says we do is we pretend it ain't happening here. It ain't
yeah,
happening. And so I'm bet that with Nick, with Crystal, I know with me, that the first thing I do is to say, oh, I live. Because I learned as a child to dissociate from my body. You know what I'm
Mm-hmm.
talking about, Nick? I just left it behind. Crystal, you know, I just left my body behind so that I wouldn't feel totally dead when I was beaten. When I was hit and I blacked out, I didn't know if I was coming back. Yeah, Nick, what are you going to say?
again, how do I start this? Saying what you're saying from, say, a physical point of view is, and emotional and everything else, and our own health.
Mm-hmm.
Yes, I totally recognize and totally, but then you've also got to look at us being practitioners, and as well that it has that effect on the people that we work with. Just for instance, just for an example, I've been put in a position this last couple of weeks where it was like, I know my team is safe,
Mm-hmm.
but I've got to rescue all these 15 children. Do you know what I mean? And try
Yes.
and sort whatever out. However, on reflection, my team actually came back and said, Nick, as far as we knew, you could have been raped, you could have been beaten up, this, that, and the other. But then, because you're in that such protective mode for
Mm-hmm.
everybody else, and you're in that, well, I can deal with this, I'm going to deal with that. You're safe, and you just take everything out about you to make sure that everybody else is safe. Do you get what I
Yeah.
mean?
Thank you. Thank
So
you,
then,
Nick. Crystal knows
Absolutely.
about that. Crystal, go. Thank you,
Oh,
Nick.
you know, I don't like to cross talk or double talk. However, Nick, I have some similarities in dealing with gynecological issues. I did not have my first child until I was almost married 7 years. And between that time, I had multiple miscarriages due to domestic abuse. So I didn't even attribute the miscarriages to the domestic abuse because at age 16, while I was not sexually active, I had not had a menstrual cycle in a year, and I was put on medications that are adult medications for women who are going through menopause. And here I'm 16, my mom's going to the gynecologist with me, and you know, my hymen and everything was intact. However, I felt so invaded and unbelieved.
yeah,
At that point, um, you know, we don't talk in certain communities. I had no idea that both on my maternal and paternal side, that there were gynecological issues, fibroid tumors, issues with the breast issue with the ovaries, all of that. And who should be the one, the very small percentage that will gain all of that was me. And no one wants to talk about it in the sense that I did not have that family support because, oh, we don't talk about that. So, yeah, it was
So,
difficult.
Crystal, you're saying two things which are so familiar to trauma survivors. Let's just name them. Number one is you've got some pain, and you've got some pain that, number two, nobody will acknowledge, talk about, tell you the truth about. And that makes the pain feel insane.
Yes.
Did you feel that? And you too, Nick, did you?
Yeah.
Can I also say, I never forget, I think after my second daughter, my first daughter, my hormones just totally turned to me, which was just so beautiful. So I could embrace motherhood and everything else. But then after my second child, and it wasn't anything to do with me and my child, but it was to do with circumstances of whatever, don't really want to get into.
Yeah, understand.
But it just brought a lot more stress. So it affected me going forward like I did with my first child. But it also, the stress affected my hormones, which was a lot later for me to recover. It took a lot longer to recover from the birth and everything else. Oh, sugar, and I forgot the point where I was getting at to with that. But
Well, you're
that
making a
was
really
it.
good
And
point.
then
Go ahead, go, sweetie.
but then I realized I was in so much pain and I was having so much traumatized, and I'd ended up going to the doctors, and they actually suddenly came up to me and said, "What do you want us to do, Nick? Do you want us to tell you have cancer?"
What?
And I just went,
Oh, Nick.
and I
Wow.
went, "Are you stupid?" I said, "Yeah." And I just went, "Are you stupid? Of course I don't want you to tell me I've got cancer. I want you to help fix me." And then about 3 years later, that's when we found out I had the tumor the size of a rugby ball, you know? And I just but this is what I was trying to get at is women are superfood, we're hypochondriacs, we're this, that, and the other. And it's like, you don't realize the effect of hormones, what it has on everybody's body, but especially a woman's body.
Nick, I really want to thank you for saying that. And I just want to ask Crystal for a second, because can you tell us why you put this on the screen, Crystal?
Sure, absolutely. Holly Elissa and most of our guests are trauma survivors. So we speak in an authentic voice.
Yes.
We understand that some of the things that we may say may be a trigger for you, may frighten the heck out of you. We have the support of Warm Lines for you. And these are free calls that you can make. They're available in most of the 50 states. However, if they're not in your state, some other states do support multiple states. And for our listeners on the podcast, that number is 1-800-643-7462.
Thank you, Crystal.
I'll say it again because I'm having some issues. We'll talk about it shortly with my mouth. But that number again is 1-800-643-7462.
Thank you. And the challenge that we have, which we're inviting Nick and other people to help us out with, is we've got listeners from South Africa, from India, from the UK, from many places, Canada, and we don't have warm line numbers for them. So if you find that your area has a warm line number that you can call, which is not a judgmental thing, it's not people that are looking to put you away, it's people that are trauma survivors that can say, I will listen, I hear you. That's invaluable. And I was just listening to what both of you were saying and feeling, yeah, oh my gosh, this is triggering some things in me. And what I want to identify, Nick, from what you were saying and what Crystal is saying is here's the double whammy. The double whammy is that we have things going on in our bodies. Number two, we don't get to talk about it. Nobody tells us about it. And I'm stunned to hear that Nick was told. So
Bluntly and coldly.
girl, they didn't tell you. I mean, what a way to find out you've got this dreaded illness. Horrible. And here's the second whammy, in addition to those. Nick, you nailed it. Women are not listened to. We are not heard. That's what all of the data says. And I know from doing research on this legally that if a doctor spends simply 2 more minutes truly listening to his or her client, that doctor has a 50% less chance of being sued. Now, what does that say? That says we need to be believed and we need to be heard. And so here's how it sums up, my friends. When we talk, when I say to the doctors, I have complex post-traumatic stress disorder. This comes in part from early childhood sexual abuse that had to do with my mouth and throat. Now, just saying that out loud could be putting some doctors out in the stratosphere. Maybe they also were abused, or maybe they can't handle a woman talking about this. And so when I say that, I need to monitor, and Nick and Crystal, you know this, monitor how evenly I say it, how careful I am to give the data, how specific I need to be, and I need to be like a lawyer arguing my case. Here is the complex post-traumatic stress disorder. Where does it come from? Early childhood sexual abuse that continued for a long time. Where was the abuse specifically located? It was oral sexual abuse on my mouth and my throat. And so why is this relevant to what we're doing here today? I'm having an endoscopy, not just a colonoscopy. And the idea of anybody putting anything into my mouth, down my throat, will send me out of the hospital screaming with my Johnny flapping. I can tell you that's what panic disorder, that's what complex post-traumatic stress disorder does. So I am here, doctors, to share with you, this is my situation. I'm also a 77-year-old woman who's an attorney who manages positions of responsibility. And what I'm asking you to do is to work with me so that I do not have to be facing that feeling of the invasiveness. When you are putting something into my mouth, I do not want to be conscious. When you are pulling something out of my mouth, I do not want to be conscious. Can we talk about that? And in almost all cases, except for one recently, the doctor said to me, girl, I'll give you a cocktail that you won't be feeling any of this stuff. And we'll make sure that we've got all the apparatus out of your throat before we wake you up. And I said, thank you. That matters deeply to me. The one time this didn't happen was in a recent, oh dear, it was a DNC, another women's issue that I had. And the doctor was great, but the anesthesiologist just didn't get it. And my conversation with him was so terrifying that when my doctor came in, I said, look, this man has just told me that I could go brain dead. This man has just told me. He went through the list of like the 1% chances. And as he started doing it, I said to him, look, I know you're doing your job. I want you to know that I'm also an attorney. I understand you have to state all of the things that could go wrong. I invite you now to consider that I have complex post-traumatic stress disorder. My brain is focused on hearing, am I safe? And you have devoted 99% of your time with me to tell me about the 1% of what might go wrong. Can we agree that you will show me the list and I'll read it? Or can we agree that I understand there are risks and as a fully adult person, I consent? No, he couldn't. He couldn't
What?
get he couldn't get it. And so when my doctor came in, I said to my doctor, look, you understand about this complex post-traumatic stress disorder. I have just been triggered up the wazoo by meeting with the anesthesiologist who insisted he had to tell me everything. Even when I told him as an attorney, I consent, you do not have to tell me all. And he kept going. So there it was, my friends, and Nick, Crystal, everybody that's listening. We have, as trauma survivors, not just the challenge of facing the fear. The fear
Mhm.
for me is, will I run out of that room when somebody starts coming at me to put something down my throat? And it reminds me of being an infant when my little baby's body was being overwhelmed. Will I feel like running out of the room because all I know to do is to escape or to hurt myself by dissociating? Or can I ask for help? And when I can ask for help, that brings my adult self into the situation. But Nick and Crystal, you both have faced situations like me.
Yes. When
Tell the
people
truth.
disrespect, and it happens more for women of color and women who are in marginalized statistics.
You
And
got
it's
it.
so unfortunate that we talked about this last week about how do we respect as trauma survivors people in authority. And when that authority is abused and you openly share, I have complex post traumatic stress disorder. So when I come in for a regular tooth cleaning and you tell me at the last minute that I have to have a root canal, what the heck?
Huh?
And I was in my doctoral program, and this was a hybrid course. I said, okay, I can leave work. The dentist office is near my home. Get my teeth cleaned, make it back home. It's my day to present on camera. I already have my presentation ready, and you know, you and I as co-presenters, how crazy I am about that. But I had no idea I was going to get a root canal. So I make it home just in time to get on camera. And I share behind in the comment to the professor what I just experienced. Is there any way that I can go next week? He said, all the slots for next week are covered. You need to do it today. I
Ah,
don't drink, but I drank that night. I was like,
I hear you, girl.
I
Ah,
I I got a good grade in that course, but I wish people would understand how much that tugs at our brain.
and I just
Oh
want
my
to pick up
goodness.
also on what Nick said, because Nick, what you said that goes right along with Crystal was you had this crisis last week, right? And what did you do? The first thing you did was make sure every child for whom you were responsible and staff member was safe. What they needed to know was that their leader was safe. What you were thinking
Yeah.
is, that's not my first job. My first job is everybody else. What our brains get frozen into as trauma survivors is mere survival. And
Mm-hmm.
survival as a traumatized child means my job is to take care of everybody else.
Right?
That's what's unique, because my job is not to take care of myself. What I've noticed, and I want you guys to, I invite you to talk about this. I will go through crisis after crisis, making it through. I bet you
Mm-hmm.
guys do this too, like Crystal presented. Nick, you made sure everybody was safe. Crisis after crisis. And only when it's over do I fall apart. And when I
Mm-hmm.
fall apart, nobody gets to see me, because I do not
Yeah.
want anybody to see me vulnerable. Does that make sense? Nick, have you had that?
Yeah, you tend to hide away, and I mean, this year has been rather a tough year for me because I've been very busy trying to save the world. Pre-COVID, during COVID, after COVID, and then after another long story, I crashed in February. And I have beating myself up because I've been so lazy. Some days I've been in bed till 3 o'clock, but right, I'm off to work to do the kids, play the kids, and this, that, and the other. But I've beaten myself up about it. But also, I've recognized I actually needed that healing time. I need that
Mm-hmm.
quiet time. And let's start going forward step by step, healing and look after others, but also remembering to look after yourself along the way. Because, as I say, there's so many different traumas that I've been through. And you talking about doctors, I remember an incident when I was 14, and this doctor actually was seen about 5 years later. He had been abusing women, and
Mm.
he had done something to me, and I was only 14, and I thought, this doesn't seem normal, this doesn't seem right. But then when you talk it to adults in your circle, it's that typical, no, doctors don't do that, they're loyal, good citizens, and this, that, and the other. It's like, well, what I've just gone through really isn't right.
Right, right.
But you know what I mean? But you're
I
made
do.
out
And
always.
Nick, what does that do to your trust?
Oh, it's crap.
There's no trust left, right? You trusted this doctor to take care of you. Instead,
Mm-hmm.
he invaded you. Crystal made a really powerful point too, which is she's exactly right. If we are people of color, or we are in a certain class of people, or
Mm-hmm.
ready for this, if we're older,
Mm.
we don't get taken. We are non-people. And
Yeah.
there you were, Nick, you were 14. Crystal, you're black. You're black. And I'm,
Yeah.
yeah, honey, there's no denying that. Yeah. I mean, I'm black too, but we don't see it. And I was not raised black, so
Right,
I don't
right,
claim
right,
that. But the truth, I claim it, but I don't claim it as my
right.
reality growing up. So what we're saying here is, look, trauma survivors facing our deepest fear, that brings up our deepest fear. Nick has already talked about being 14. She's talked about being pregnant. She's talked about being told secondhandedly she's got cancer. Crystal is talking about being a PhD or EDD student. And what happens? She thinks she's going for teeth cleaning. That's invasive enough to those.
Mm-hmm.
And yet, what is she told? Oh, and by the way, you're having a root canal. Now, a root canal can cause for anybody the greatest gagging response, right? Oh,
Yeah.
and
Yes.
and then you go to a colleague and you say to your colleague, I have just been through a trauma, however you phrased it, and I'm prepared, fully prepared, but I
Mm-hmm.
need space to get myself back into my true self. And what does he say? Forget it.
Yeah. Hey,
Forget it.
yeah, no consideration. And it has happened, unfortunately, so many times for me during my 18 surgeries. Is I don't want to believe that it's okay to disrespect. No. And, when I speak up, I get that side eye. Who does she think she is? Oh, you're not. you got the wrong one. And I feel so bad thinking, what about the individuals who are not capable for advocating for themselves? That
Completely.
is so, yeah. And like you, Nick, when I was told that I needed to have a hysterectomy, I had the 3 children that I was told I was never going to have. And they suggested that I attend a therapy group for other women who were going through a hysterectomy. And this was at Carmano's Cancer Institute. It primarily was in Detroit. Now there's different locations all over in the suburbs. But the main center is now in the medical center in Detroit. I had a great doctor. He was so compassionate. But the one day he asked me, after I had had the 3rd surgery, how were you feeling? As I'm bleeding like a pig.
Oh,
And I'm thinking, okay, you guys haven't fixed it yet? I'm sobbing, I'm telling them I'm emotional, I'm depressed. Then somebody comes down in my room with a white jacket. They're suggesting I go to the psych ward. That's
This
not what I needed. And I'm not shaming for those who do. All I'm asking is for you to listen.
and be
Go
a
ahead,
human
Nick.
being and be a human being and listen, because
Right.
you think throughout history, though, what as women have had to really go through.
Mm-hmm.
I'll say this: my nan, she was seen as depressed, mainly because of situation that she'd been put in. But she used to be sent to a mental hospital and have electrical treatment on her brain, electric shocks, and
Mm-hmm.
which was diabolical. But you think years ago, because people didn't understand the menopause, blah, 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 how many women were seen as witches and burnt to the stake or
Mm-hmm.
totally insane insanity. So let's institutionalize them, let's put them all on these drugs. And you think that effect has had genetics, chromosomes, absolutely everything on lots of other decades of people
Mm-hmm.
growing up.
Nick, you're exactly right, because we now know, not everybody believes it, but look at the evidence that there is intergenerational
Mm-hmm.
trauma passed down genetically. Crystal
Yeah.
and I know Crystal said this out loud, so I can say it. Nick, Crystal and I both have grandmothers who were
Mm-hmm.
put in what we called insane asylums and given shock treatment. Nobody
Yes.
talked about that. We had to find out about that. But my mother, who was mentally troubled, psychotic, refused to see doctors because she was so terrified. This probably she never said this. The same thing would happen to her. And so I, as a child, raised my mother when she was going through several depressions and what was called nervous breakdowns because she refused to get help. What I want us to do here, my friends, I want to thank you for laying out clearly. These are the repetition of the traumas that we never got to grieve, that we never got heard about. And now here we are, adults. And here we are in this program called Trauma Survivors Walking Each Other Home. And the question
Mm-hmm.
I'd like us to address, because I need to feel like we've got hope here too. Not pretty,
Mm-hmm.
cover it up, Pollyanna hope, but what, Nick, what, Crystal, what, Holly Elissa, have we been able to do to get the kind of care and treatment that we need. And at the same time, and this is crucial to me, I'm just going to say it, to face the terror I have inside myself when I think I'm going to be like my mother and my grandmother and I'm going to go crazy.
Yeah.
And I can't stand the feeling of that. And so I'm going to avoid. I can't avoid. When I went to this colonoscopy doctor, and I have to go every 3 years because talk about intergenerational stuff. My father passed down to me this tendency for polyps. So I have to go more frequently. I accept that. This time I had the courage first. Ready for this? So I'm going to talk now about one thing I've done. I'm going to ask you guys, what have you done to help yourself take care of yourself when we're faced with that terror that our mothers passed down to us, that our grandmothers bequeathed to us, and nobody helped them heal? Okay, so here's what I did. I'm 77, and I've had this trouble sometimes swallowing. I don't want to even think about that because as a child, I had trouble swallowing. I was told I couldn't cry. I swallowed the tears. I'm sure, and I'm not going to get graphic, but with oral sexuality, and I couldn't speak out, I couldn't scream out. There was a lot going down, shall we say, with that. And so I had this horrible fear that I was going to choke to death. Horrible fear. And it took me a long time to talk that through with a trauma therapist. So what did I do this time? I had the courage to say to what we call in America, Nick, we call it a GP, a general practitioner. In England, I used to have one in my village. I would go to his surgery. It was really lovely. But so I went to my GP and I said to her, there's something I don't want to talk about. I'm had this abuse in my throat. She's nodding. I have had physical abuse where I have been choked. And if anybody gets close to my throat, I want to smash them and get them out of my way. And I'm again having trouble swallowing. And I need to ask about that. And she, as a doctor, went right into saying, look, it's totally natural. And she explained physiologically what happens with our esophagus as we age. And so I'm not atypical. And she said, you can have this checked out. I said, girl, let me tell you about this. The idea of anybody putting anything down my throat is enough to send me beyond this galaxy. And she said, you know something? When you go for your colonoscopy, you can tell your what are they called? What do they call, guys? The endourologist, whatever it is. And we know it, and the people listening know it. But this is part of my PTSD. I block this stuff because it's scary to say out loud, right? So she said, you can tell him that's what you need. So I felt 1,000 times better just because I leveled with a doctor, and she told me what I'm having is not unusual. But yes, I have to face my fear. Then I do the next second thing, which helps me a lot. I talk with my trauma therapist. I have looked long and hard, and it is not easy to find a trauma therapist. When I found him, and I said to him, Ray, I'm scared to death. Of course you are, he said. Of course you are. And then he went on to explain to me that and he's a survivor. Anytime he has to have anything done with his mouth and throat, he has a deal with the surgeons. He will totally be not conscious. And I thank him. I'm crying because he's saying, I'm sane and I asked for this. Okay, so what happens last week? I go to visit Dr. Song, my whatever he is, Euro guy, whatever, endo, anyway, you know what I'm talking about. And we'll get to it. endocrinology, or something like that, girl. You're getting closer. And I want to say this is another fact is that we know the statistics, Nick and Crystal, we have felt this. Our executive functions, our ability to think straight, shut down by 90 to 95%. So all we're doing is surviving. So here I am with Dr. Song, and I'm doing my thing. I'm asking about his twin kids and how they're doing. And I'm answering his questions. And I'm building a relationship. At the same time, I'm talking with him about what I need. And it's only at the end, at the very end, are you surprised? That I say to him, Dr. Song, I understand that you can also check. Sure, before I even said anything. Of course. He said, what's challenging you? And I said, well, sometimes it's tough. Of course. Of course. So he's ready. And I said to him, I have abuse. And just going through this procedure it feels impossible to me. So you and I need to talk and be clear that for both this procedure and the colonoscopy procedure, I am protected from the re-traumatization. He said, yes. Have I been afraid since then? Yes. But will I face it? Yes. So my friends, I want to share in our remaining time, I invite you to share. That's what I did. I'm still scared. I don't want anybody down my throat. I don't want anybody up my privates, but I know I've got to do it. And so the maturity comes by making the choice, number one. 2, asking for help of people that can help. 3, getting therapeutic help as a trauma survivor, asking for that. And 4, leveling with the doctor. And 5, saying, I need you to hold my hand and understand. So those are the 5 things. Now, Nick and Crystal, you guys have faced this. What can you tell our listeners that works for you about facing these abject fears that has helped you be adult and take care of your little girl inside?
Yeah. And now you mentioned to me, and you've mentioned it online too, that you also make sure to take someone with you. And a lot of these procedures in the States, we are required to bring someone with us. And they have, to stay during the process because they don't want you driving home alone. So that's your 6. Now, Nick, I'm gonna have, if you don't mind going, to talk about how are we dealing with the things we have to do to maintain our health, yet we still are dealing with terror as trauma survivors.
Nick, what's helped you from the inside out?
Yeah, she's thinking.
To be honest,
see it.
A lot of it has been trying to find that inner power, that inner strength.
Yes.
To be able to just sometimes scream out and go, I'm not okay. Scream out for help. Even if you don't get it, or even if you get it off a stranger or a random person, it's being able to have that ability to just go, I need help. And as you said, Holly, somebody hold my hand. Somebody human to me. Treat me like a human being, that I matter and I'm not this obsessive or lunatic or whatever you want to put with every bracket of society, being a woman, being a girl, being a human being. Do you know what I mean? It's like
yes, we hear you, girl. We hear you.
As a human being.
Yes. When I asked after this doctor, the anesthesiology was so, I think he was abusive. He thought he was doing his job. I understand that. But when in came the nurse, I said to her, I've just been re-triggered. Would you hold my hand? She absolutely said, of course I will. And I also had my friend there who's a nurse, who's also a trauma survivor. And as I started describing to my gynecologist what happened, the nurse is holding my hand and nodding. My friend is holding my hand and shaking her head. She can't believe this happened. And my gynecologist is saying, I am so sorry.
Yeah.
I'm so sorry. Now, when it's time to get the injection, I feel supported. And Nick,
Mhm.
I want to believe, and tell me, please, when it's been time for you, when you've said, I'm hurting, I need you to be here for me. Have you gotten
Well,
the
to be honest, at the moment, especially this last 12 months, a lot. I've been screaming out. But I'll just go back to the incident where, oh, what do you want us to do? Tell us you got cancer. Like, no, are you stupid? I just want you to make me feel better. And but
wait,
I never,
I just need to clarify. They said, are you stupid?
yeah, oh, but the hospital said to me, are you stupid? Do you want us to tell you you have cancer? And then I went, no, you're stupid, because the
Yeah.
last thing I want to friggin' hear. I just want to know how I get better, what is the matter. But I remember having to go for an ultrasound, no, a certain procedure,
Mhm.
and because I'm into qigong and tai chi and meditation and stuff. And anyway, it was quite an invasive procedure, and I just said to this woman, the nurse at the time, I said, listen, I'm going to be a baby, got a bit of trauma, this is scary, can you just please hold my hand and I'll do the rest? And I meditated so hard through it. I've never done breath work like it in my life. And even the doctors and everybody were just sat at the side of me in awe, going, oh my God, you've had such invasive procedure, you've had no treatment, or drugs or anything.
Mm.
And I
Mhm.
go through that, but it was the power of accepting that they know I'm scared,
Mhm.
accepting that somebody's there and going to hold my hand, but
Yes.
also to do that power, mind over power, over body, and just transcend, because as trauma victims are going through trauma, as you well know, we have to raise ourselves out of our body at that
Yeah.
time
Dissociation,
to
honey, it's not healing, but it's what we learn to do from birth.
Yeah.
And I
Yeah.
also want to comment on what Nick said, not to judge, but to just say, here's something I noticed. When you said the doctors, the medical people said, are you stupid? Your response to them was, are you stupid? Now, what they can do with that, you're just telling the truth and you're being at their level, their allegedly professional level. But what they can do with that is say, she's out of control. And so the problem that we also have as trauma survivors is we have to, I feel, I have to maintain my integrity in the midst of people accusing me. Again, Crystal, I want to hear from you, sweetie. What helps you? And then I'm going to read a section from my book on this stuff. So, Crystal, what has
Yeah.
helped you be true to yourself when you're
Mhm.
faced with abject fear and you need help?
Well, before I speak about my experience, I want to say something. Have you had the colonoscopy yet?
No. I mean, I've had one every 3 years for
Oh,
since I was
okay.
50, but it's coming up. And you know what I'm
And
trying
so,
to do? It's scheduled for January, but I'm going to call each week to see if I can get in early because I don't want to put that thing off.
yeah,
yeah.
I have a procedure coming up next Monday, and I'm not ready. So I'm going to reschedule because I know the pain is going to cause to my back.
Uh,
But I was just thinking, why do they call it go lightly when you poop like a faucet coming out your butt?
thank
I'm
you,
like,
honey.
you do not go lightly. Okay, I'm
All
sorry.
right.
Um,
We hear you.
for
Mhm.
me, what has really helped me. Prior to my dad passing, it's not that I did not have a good relationship with my mom. I was a daddy's girl. My dad went to medical appointments, surgeries. He was there. Now my mother is there at every surgery. So she done bite her tongue. So if I forget to say something, oh, they're gonna hear from her. When they say, oh, she's going home tonight, my mother said, oh no, she's not. So that's speaking up.
I love that.
Also, as
Yeah.
you and Nick said, that disassociation. So as I'm going through a procedure where I may not be asleep, I either have on headphones where I can meditate or listen to some music. And one of the therapies that I had over the last year was because I've had all the gynecological surgeries, my vaginal cuff or something was weak, my bladder was weakening. So the urologist suggested that I have vaginal therapy. And so I said, and he's in the room with two residents, male residents. So I said, well, what does that entail? He said, well, it'll help strengthen your bladder and, the lower level of your vagina. When I went, I told the female therapist, and Nick, I too am a survivor of child molestation from an aunt and uncle. So, I have some issues. So when she told me she was going to put her fingers in my vagina and massage, I was like, oh, hell no, you're not. No. Mm-mm. And it took me a long time before I kept rescheduling those appointments because I just couldn't tolerate it. So when I did have the courage to go, and she empathized with me and understood, and she said, I'm going to tell you everything I'm doing before I do it. And I appreciated that.
Oh,
So
Crystal,
makes-
I hear you. I hear you because I have had the same procedure, and it's so strange. And I had to, but I want to conclude, my friends, with reading a part of my book because I faced heart surgery. Of course, as a trauma survivor, I would have a broken heart. All of the illnesses that we have are metaphors. And so I'm going to read just the part where I was terrified. I was terrified, but
what page?
this is on page 251. And the first thing I do is I met with my trauma therapist, and he said twice a week. I figured somebody's listening to me. He gets it, how serious this stuff is. So Dr. Gray and I met twice a week. He listened, at times wincing, when I dared at last to release the sound of my mother's soul-piercing moans when she went into one of her alternative states. And you know what I'm talking about here. I almost plastered him to his brick office wall. His questions were rarely easy. I made a commitment to myself to trust this talking cure. I committed to facing and sharing the shaming things that I least wanted to face. Truth I chose to believe would set me free. And there's a quote by Hafiz here that says, this place where I am right now God circled on a map for me.
Mm.
It's no accident that we face these traumas again and again. I befriended and leveled with my surgery team. I told them I have complex post-traumatic stress disorder. I asked them to be sure I was out before they inserted tubes or instruments. We laughed together as I joked about my fear about running out of the hospital with my Chic Johnny flapping behind me, because that's what I thought I might do. As the days counted down, I became as ready as I could be. I had told my secrets. I had owned my disability. I had owned my PTSD and panic disorder. I had asked for and received help. I no longer felt alone.
Mm.
I no longer felt alone. What had petrified me in the end liberated me. I lay on my back for a 4-hour ablation with a tube down my throat and a probe up my groin. I did it. I did it. The demons, too, lay on their backs for a much needed rest. I rested as friends took care of me, brought me food, streamed chamber music I loved, watched my favorite movies of the 30s and 40s with me. Kathy and her therapy dogs drove hours to be with me. Those loving, smiling beings wagged me to sleep, resting their gentle, furry heads on my feet. Marina, another trauma survivor, stayed by my side until she was sure I was strong enough to regain my sassy attitude. October 31st, the surgery happened. The surgery failed. I felt that immediately in the ICU. My heart beat out of my chest. My medical team and I were, to say the least, disappointed. I landed in the 30% of failed ablation surgeries with no guarantee future surgeries would have a better outcome. Now listen to the difference. Listen to the difference. I was not quitting. I had faced my biggest fear of going insane. I had faced my biggest fear of going insane and made it through. Let's schedule the next surgery, were my first words to my cardiologist. We rescheduled for December 18th. Oh, I returned. I went to India. I went to Sri Lanka. I went to all these places. I lived my life. And when I returned to the University of Massachusetts Medical Center, I returned to lie on my back with a tube down my throat and a probing instrument up my groin. I returned laughing, welcoming my demons at the door, inviting them in, trusting them to be messengers with good news from beyond. This time around, my second ablation was a success. Dr. Robotis, celebrating with me, allowed that he had devoted an extra hour inside my heart to eliminate any remaining source of misfiring that would spike palpitations. My broken heart had been healed from within.
Oh my goodness.
You both know what I'm
And that's
talking about.
so true.
Nick,
Oh, Holly, I
Nick,
really want that book. I
okay,
really want
Nick,
it.
my gift to you, Nick, I will get this book for you and I will have Holly Elissa send it to you, or you can share
That
your
would be
address.
so, you know what, Holly had
I
sent.
appreciate you for
Thank you.
stepping up and stepping out on this platform with us. So
Thank
you are getting this book.
Oh, you know what? Holly sent it me a couple of years ago via audio, but for some reason I still couldn't download it. And
Yeah.
the title is enough for me. Then Holly also writing it and going through her presentations. I just so would love to feel the pages, to see the
Look
cover.
at this.
Oh,
You
girl,
know
it
what I mean?
matters. It does. We need that grounding, girl.
Yeah,
Touch
I
the
feel that. So, oh, exactly. It's like, I don't want to hear it.
Right,
I want to feel it.
You know what? When you get the book, Nick, you'll see, and Crystal can see this. I hear you, honey. When you touch the edges of the book, they knew what they were doing so much. They sat with me to hear what the book was about, these publishers. They made the edges. How would you describe that, Crystal? The edges of each page.
So, most
They can be jealous
typical
now,
books,
aren't you?
they're
No, we're
cut
sending it, girl.
hard. They're really cut hard. These are not like that. So you're not going to get a paper cut.
You're going to feel the edges, just like we all have
Right.
edges. My friends, we need to close. I love you both, and I love your courage. And isn't that the gift?
Yes.
Isn't that the gift? I say, my vulnerability is my greatest strength.
Mm-hmm.
Nick, you too. When you,
I'm just starting to learn that now.
yes, I'm still learning it, girl.
Yeah.
We can talk about this. Crystal, how about you?
Oh, you're gonna make me cry. But
It's okay, girl. I'm with you. I'm with you.
I am so blessed. In May, I celebrated my 60th year of life. And some people couldn't understand, what's the big deal? 60. Aren't you looking for 61? But to make it to 60, woo! With bald head, fancy guts, braces on your teeth.
Hair
I'm
toss,
good.
check my nails.
Oh,
You know what? When my sister, who's a trauma survivor, and how she dealt with it, she got all kinds of degrees, all kinds of degrees. She became a doctor, then a psychiatrist. When she turned 80, I said, the first thing I said to her was, Lynn, can you believe you're 80? And her instant response, without thinking about it, was, no, I didn't think I'd live this long. The
Wow.
ACEs, Adverse Childhood Experience Study, says I should be dead. Crystal should be dead. Nick, I don't know about you, honey, but you might feel like you're lucky to be alive.
Mm-hmm.
Because the trauma we faced as children almost killed us every time. And I'm not being dramatic about that. When I got punched out by my father and I blacked out, I didn't know if I was dead. I didn't know if I was coming back. When he would abuse me and I couldn't breathe, I thought this is the end of my life. So when I get faced with surgery, my body says to me, don't do it. Don't do it, sweetheart. Don't put yourself through that. And like Nick, you said, I have to go to the place of serenity deep inside of me. And that serenity deep inside comes from weeping, crying, screaming, telling the truth, asking for help, and being very, very caring to that little girl inside of me who never had anybody there for her. Now I do. But she's got to start to believe that.
Yes. And we're here to help one another.
Yes, we are, honey.
Journey.
All right, my friends. Love you. We'll see you, I hope, next Monday. Crystal and Nick, and let's invite other people too. Crystal, anything you want to say to close about this podcast, which I think might have officially become a podcast today on Spotify?
Yes, I'm going to check it because it's been rolling as we've been rolling on Zoom. And that's just God continually increasing the territory because He has given value to our voices and not to feel ashamed for telling our stories, which means we are not putting the pen or the pencil in someone else's hand to tell our stories. We're doing it.
Amen, honey. I'm going to say goodbye. Love you all. And we'll see you next week.
Yes, God willing.
Thanks, Nick. Thanks, Crystal. Love you. Bye.